Hello and welcome. My name is Debbie Banal, and today I'll be presenting for you the 2024 ABCs of Medicare Education. So the goals of my meeting today are to give you an explanation of Medicare and also understanding the ways that you can enhance your Medicare. So option one that we'll talk about is called a Medicare supplement or a Medigap plan, and option two is a Medicare Advantage plan. So now let's define some of the terms that you'll be hearing quite a bit. So Social Security is a federal program that provides benefits for those that are survivors, retired, or disabled. Now, a lot of the times you'll hear Medicare and Medicaid used in the same way, but they mean completely something different. They are not the same. So Medicare is a federally funded health insurance program based on age or disability, whereas Medicaid is state and federally funded, and it's based on income. If you are receiving benefits from Social Security or the Railroad Retirement Board prior to the age of 65, you're going to automatically be enrolled in both A and B on the first day of your birthday month. Now, unless your birthday is the first of the month, and in that case, your benefits will start the first of the month prior. If you are not receiving benefits and you want Medicare to start the month that you turn 65, you must enroll by contacting the Social Security Administration. Now, you also may be enrolled in Medicare through Social Security after being awarded disability after 24 months. Now, there's some exceptions to that as well, such as Lou Gehrig's disease or end-stage renal. If you or your spouse is still working and turning 65, and you're covered by an active employer group health plan, you may be able to delay Part B of Medicare without penalty until you retire. Now, in case, Medicare will pay primary or secondary to your employer plan depending on how many employees are in the company. If you've elected to delay Part B, it's important to remember to apply at least 2 to 3 months before you retire. This prevents any breaks in medical coverage, and it also avoids the Part B penalty. Now, you will be asked to complete a form. It's called CMS L564. So you and your employer will both complete that form, and then you will either take it to your local Social Security Administration office, or you can fax that in. This basically proves to Social Security that you had coverage since you turned 65. Now, if you have an HSA, a health savings account, through an employer group coverage, you should stop your contributions at least 6 months before you apply for Medicare A and or B and Social Security benefits. Always, we encourage you to talk to your HR department, your tax advisor, or you can simply call the Social Security office. So a lot of the times we hear, well, I'm going to be on COBRA. So let's talk about that. So COBRA is a federal law that was passed in 1985, and it provides continuous group health insurance for employees and families after a job loss or any other qualifying event. Now, Medicare and COBRA. COBRA is not considered to be creditable by Medicare. So to avoid a penalty, sign up for Medicare as soon as you're eligible, even if you are offered COBRA. Now let's talk about some ways to avoid some penalty. Always sign up for Medicare when you're first eligible to avoid the Part B penalty. Also, you want to sign up for Part D coverage when you're eligible. And if you've worked past the age of 65 and you're ready to retire, you'll need to sign up for Medicare Parts A, B, and D to avoid penalties. So now let's really talk about what are the ABCs of Medicare. So original Medicare has two parts, Parts A and Part B. Part A of original Medicare covers inpatient hospital stays, skilled nursing, hospice, and home health care. Part B of Medicare is called your medical coverage. It covers doctors, specialists, outpatient services. Part C is simply a Medicare Advantage plan. It will include Parts A and B and sometimes Part D coverage. And then Part D is simply prescription drug coverage. Now, because Medicare is an insurance program, there's going to be premiums associated with that. So for 2024, let's take a look at your Part A cost. If you have worked for 40 quarters, which is 10 years, 4 quarters each, you will pay nothing for your Part A of Medicare, so the premium for you would be zero. However, if you've had 30 to 39 quarters, you would pay $278. And if you have less than the 30 quarters, you would pay $505 per month for Part A. Now, everyone will pay for Part B of Medicare, and the standard premium in 2024 is $174.70. Now, please note it says the premiums may be higher based upon income. That is because Medicare looks at your income tax from 2 years prior. So in the case of 2024, they're looking at your income taxes from 2022. If you filed individually and made $103,000 or less, or filed jointly and made $206,000 or less in 2022, then you're just going to pay the standard $174.70. However, look down that next line. If you made above 103 up to 129,000 filing individually, or above 206 up to 258,000 and you file jointly, then your Part B premium is going to be $244.60 per month. And you can see as you go into that highest income category, the highest premium that you would pay per month is $594. Now keep in mind, if you pay more for Part B, you're also going to pay more for Part D. Now that same income and tax year is still used for the Part D costs as well. If you look at that first income line of 103,000 or less filing individually, 206,000 or less filing jointly, then you're just going to pay whatever the premium is for the Part D plan that you enroll into. But going down that next line, filing individually 103,000 up to 129,000, or filing jointly above 206,000 up to 258,000, not only would you pay the premium for whatever plan that you enroll into, but an additional $12.90 is going to be added each month to the plan's premium. You can also see that very highest income level, an additional $81 per month would be added to the premium of the plan. So now let's take a look at what your out-of-pocket expenses would be with Part A. Now Part A has a deductible of $1,632 per 60-day benefit period. A benefit period is defined as it begins the day you go into the hospital and ends when you've been out 60 days in a row. Why that's an important date there is because even if you go back into the hospital and 60 days has lapsed, even if you go in for the same condition, you're going to meet that $1,632. Now, if you're in the hospital consecutively on days 61 through 90, it's an additional $408 per day. And for your lifetime reserve days of 91 through 150, it's an additional $816 per day. Now, skilled nursing is defined as short-term stays, not long-term care. Under Medicare guidelines, you have a 100-day benefit period. Of those days, days 1 through 20, Medicare is going to cover your costs at 100%. But days 21 through 100, you would be responsible for a copayment of $204 per day. And then please note that days 101, it says not covered. That's because that would be completely all self-pay. Your home health and hospice would be covered for you at 100%. For Part B costs, some examples of Part B could be doctor visits, lab services, emergency, urgent, chemo, radiation, any type of diagnostic testing, ambulance, emergency, outpatient rehab. The Part B deductible for 2024 is $240 per year. Now, once you've met that deductible, Medicare is going to pay 80% of the remainder of the year, and you're going to pay 20%. Now, something to keep in mind for original Medicare A and B is there are no out-of-pocket maximums for A and B. When you have a plan that offers an out-of-pocket max, basically what that plan is saying to you is If your out-of-pocket or costs reach a specific dollar amount, that means that plan is going to cover you for the remainder of the year. And keep in mind, that does not have out-of-pocket maxes for original Medicare A and B. Now, you also get your preventative benefits covered for you at 100%. Things such as mammograms, prostate exams, um, lung cancer screenings. All of those are part of your wellness benefits, including like flu shots, pneumonia shots, COVID vaccines, your annual wellness visit. Now, these services are covered at no cost unless you have a medical diagnosis. Now, there are ways that you can enhance your Medicare. So now we're just going to talk about options 1 and options 2. So option 1 is to take a supplement plan or a Medigap plan to fill in the costs that Medicare doesn't pay for. And keep in mind, you still need to get a Part D plan even if you're going to take a supplement, because supplements only cover the things that Medicare itself does not cover. And then option 2 is a Medicare Advantage plan. Now this option combines parts A and B of Medicare and sometimes Part D coverage. Now either way, whichever you decide to do, please remember you still have to pay your Part B premium. So the first we're going to talk about, option 1, is a Medicare supplement. Those are always identified by letters of the alphabet. There's plans A through N. Now there are some plans that if you're not allowed to enroll into if you've turned 65 since 2020, such as Plan F or High Deductible F. These plans will always pay secondary to Medicare. Depending on which plan you choose, it may pay all or some of the costs not covered by original Medicare. Typically, you can go to any doctor or hospital that is contracted with Medicare unless you choose a select plan. The premiums typically depend upon your age, your health, and where you live. And in Ohio, if you are under the age of 65, those would not be offered to you. Now, you can enroll into a supplement plan at any month. However, you may have to answer medical questions if you do not have what's called guaranteed issue. Guaranteed issue describes a time where Medicare supplement policies are offered to any eligible applicant without any regard of how your medical status is or your health status. Therefore, the best time to buy a Medigap policy is when you first become 65 with Parts A and B, or if you've delayed Part B within 6 months of your Part B effective date. Now, during this time period, your guaranteed issue period, insurers cannot deny you for any reason, and they cannot increase your costs due to health issues. Now, if you don't buy a Medigap plan during this time period, you may not be able to get coverage due to your health status, or you might pay a higher premium due to your health issues. So this is just a chart showing plans A through N. And you could see based upon like the X's that you're looking at, typically Plan F would have been what would have been at one time called the Cadillac plan, because it really covers almost everything at 100%. So then if you look over to the G, you can see the only thing missing is that Part B deductible. So that gives you somewhat of an idea of the plans that would be offered to you. So once again, option 1 would be a supplement plan, and option 2 is a Medicare Advantage plan. And please also keep in mind once more that no matter what option you choose, you would still pay your Part B premium. So let's talk a moment about standalone Part D prescription drug plans. You may also hear them referred to as PDPs. So you must actively enroll into a drug plan. It's not an automatic when you go on Medicare. It is available to those who have Medicare Parts A and or Part B. All Part D plans must cover at least 2 drugs in each classification per Medicare guidelines. Now, if you have equivalent or better coverage from an employer or the VA, you may not need a Part D plan. Now, the plans vary, so the most important things to look at are formularies, pharmacy networks, premiums, deductibles, and the meds that they cover. So this is just a standard benefit example. So there are 4 stages to Part D coverage. the deductible, initial, coverage gap, and catastrophic. So if you have a plan that has a deductible, you meet the first part of that deductible. Now in this example, it's $545. After you've met your deductible, you go into the initial stage. Now during that period of time, the plan pays its portion, and then you pay your portion in the form of a copayment. And then you stay in this stage until the cost of your medications at a retail total cost reaches $5,030. Then technically you go into the coverage gap. You may have also heard it called the donut hole. So during this time, you would pay 25% of the retail cost for brand name medications and generic medications. You will stay in that coverage gap until out of pocket you have spent $8,000, and then you go into what's described as the catastrophic stage, and then at that point, through the remainder of the plan year, you would have a $0 cost for your prescriptions. So why is Part D coverage important? Most people are going to need prescription drug coverage at some point in their life. Medicare prescription drug coverage protects you from all of those high out-of-pocket expenses. And also enrolling when you first become eligible means that you're going to pay just the plan premium and no late enrollment penalty. So how does Medicare actually come up with this Part D penalty? So Medicare calculates the penalty by multiplying 1% of the national base beneficiary premium, so whatever the premium is going to be, $34. So think about $34.70 for this year. So you're going to pay 1% of that. And then they multiply that times the full amount of uncovered months that you did not have Part D or creditable coverage. In 2024, each month without Part D coverage is a penalty of about 35 cents per month. The penalty begins at the time of enrollment, and keep in mind, they multiply the full times of months that you went without, times that 35 cents. Now, the ways to avoid the penalty is to have creditable coverage. You may also qualify for what's called extra help or low income subsidy. And always make sure you sign up when you're first eligible and don't go longer than 63 days without creditable drug coverage. So what is low-income subsidy or extra help? It is a program that assists with premiums, deductibles, Part D co-payments or co-insurances. It offers help through the coverage gap, and it also gives you a special election to enroll into different plans. You can qualify whether you're single or married, as long as you have limited resources, and it's very easy to apply. Simply go on socialsecurity.gov, visit your local Social Security office, or you can call, and the numbers are listed there on the screen for you. So once again, the options for enhancement would be option 1. And now let's go over option 2, which is a Medicare Advantage plan. And keep in mind that plan covers and combines your A and B of Medicare and sometimes Part D coverage. So this option combines Part A hospital, Part B outpatient services or medical benefits, and sometimes Part D. Insurance companies that are approved and subsidized by Medicare to manage your benefits. Premiums can start as low as $0, but you still pay your cost sharing in the form of a copayment. Now, plans may also add extra benefits such as dental and vision and also health club memberships. You must be enrolled in both A and B and continue to pay your Part B premium. You must also live in the service area of the plan. Now keep in mind, CMS contracts with private insurance companies to manage your Part C benefits. There are 2 different types of plans. There are HMO and PPO plans. HMO simply means Health Maintenance Organization. You must use contracted network doctors and providers for all services except urgent and emergency care. A PPO or a preferred provider organization has 2 levels of benefits, so they'll offer you in-network and out-of-network benefits. Once again, there's basically 2 ways to enhance Original Medicare. One is with adding a supplement and a Part D plan, or going on to a Medicare Advantage plan. Now, there are specific enrollment periods for your Part D and Medicare Advantage plan. So the first is your initial election. It is 3 months before, the month of, and 3 months after your 65th birthday. The annual enrollment period happens every year, and it's for those who want to make a change to their existing coverage. It runs October 15th through December 7th. Medicare also has a Medicare Advantage plan open enrollment period that will run from January 1st through March 31st. That is an opportunity that Medicare is offering you that you can change your Medicare Advantage plan one time during that time period, or drop your Medicare Advantage plan and go back to original Medicare. Now, you also have a special election if you are losing employer coverage, or you move in and out of a plan's service area, or maybe you've qualified for Medicaid or you get the extra help. So there's some important contact information listed on the screen for you: Medicare, Social Security, and the Ohio Department of Insurance. Also, the Ohio Senior Health Insurance Information Program, or OSHIP as it's more commonly referred to. Now, we are always happy to assist with any questions that you might have about Medicare education. Always feel free to call Primetime's customer service. You can ask to speak to a sales representative, and our hours of operation, Monday through Friday from 8 to 8, from October 1st through March 31st. And we do have walk-in hours as well at our office, Monday through Friday from 8 to 4:30.